Go with me to the International BioCare Hospital and Health Center in Tijuana, Mexico. You will be met at the San Diego, California International Airport by your friendly driver from BioCare Hospital. He will assist you with your luggage and then drive you the short distance to the Mexican border. After clearing customs and immigration, you will be taken approximately 5 miles inside of Mexico from the American border to BioCare Hospital. Dr. Rodriguez.
Pastor Williams.
I would like to personally introduce you to Dr. Rodrigo Rodriguez, the co-founder and medical director of the International BioCare Hospital in Tijuana, Mexico. One of the first people that you will meet at BioCare Hospital is the patient coordinator, who will guide you through all of the steps of entrance into the hospital. I would like to introduce you to Teresa Thomas.
International BioCare Hospital. This is Teresa. How may I help you?
It is a privilege to be at BioCare Hospital in Tijuana, Mexico with Dr. Rodriguez. Usually when we think of clinics and hospitals in Mexico, we think only of cancer. Since I've been here at BioCare Hospital, I am utterly amazed at the number of therapies that are offered by this particular hospital. Dr. Rodriguez, I'd like to ask you, if you will, to give our viewing audience an overview of all the different therapies and processes that can be expected to be given to them if they need it here at BioCare Hospital.
Well, Pastor, it's my privilege to have you visiting us and talking to us. And I have to tell you that most of the people that we see at this hospital is because of cancer therapies. Cancer therapies are something that have brought a lot of attention because alternatives are there. They're very useful, they're wonderful, you can really achieve wonderful results with them, and that's what has brought the attention to us. But I have to tell you also that there are many conditions that we have triggered, unfortunately, in the last couple of generations due to our lifestyle and eating habits and overuse and abuse of antibiotic therapies and so on, change of diets. There's so many things that have changed the health of our nation that we have to address them. When we have to address them because unfortunately there's not much help out there because we have to first of all understand them. So when we talk about that, we're talking about things like chronic fatigue syndrome, a growing problem in the younger generations. And this is people that should be at their prime, working and having fun and traveling, and they're sick for many hours of the day, and they can hardly work, and they have pains, and they have all these sorts of problems that have to be addressed. And this is because of dysfunction of the immune system. So dysfunction of the immune system would be one of the big things that we have to talk about. Where does that come from? Well, it comes from the fact that we have to change our eating habits, we have to change our immune system, we have to use immune enhancers, which we have, thymus derivatives. There are many therapies that can help this. Now, chronic fatigue syndrome is characterized by the presence of what we call opportunistic infections. So the use of substances like chlorine dioxide, for example, intravenously, can help us to fight all these viruses, all these candida, all these mycoplasma, all these things that really give us so many distress and so many problems and so many symptoms over the years. So when we start controlling that, everything is going to start coming back to normal. oxidative therapies. I couldn't say enough of that because hyperbaric oxygen, ultraviolet irradiation of the blood, ozone therapy, all of them have a tremendous effect on microbial infestation of the body, which again is very common, unfortunately. So when we start controlling all these things, then health starts to set in, and then we start controlling and conquering our health for our benefit and enjoyment of life, because we should be enjoying life, not being sick in a couch because we can hardly move or because of pains and aches. So we do a lot of therapies that are connected to nutrition. We do intravenous nutrition. We use vitamins and minerals. Did you know, for example, that minerals is the #1 deficiency in America? Well, we can replenish all that thing intravenously, very fast, very efficiently, and get all that energy and get all that boost that your body needs, so you can go back to work and go to function and go to enjoy your family and go around your daily activities. All these therapies are going to help us. And we look for areas where we can improve your health. Dental is very important. You know that many problems begin in your mouth because of the use of metals, because of chronic infections that we can hardly see, and we live with them day in, day out, and we don't really know what to do. Well, we need a biological dentist to work on all these areas, to clean our teeth, to remove metals. Mercury is not for your mouth, it's for your thermometer. So we have to start doing all these things so we can get your health back. And that's exactly what International BioCare is all about, getting people's health back so we can improve the health of the people and improve their performance in life. So I could say about laboratory testing, imaging, like MRI, CT scans, PET scans, all these newer fancy methods of diagnosis, all of them are available at the hospital. And we do them with conscience, because we want to use all that information to be able to plan, to be able to see the outcome of your therapies, to see how things progress, to see what direction we're taking. Live blood analysis, for example, is a very important test in which we can actually measure the activity of the immune system. If we can have a good immune system, taking care of our body, guarding us from all the infections and parasitic and microbial life that is around us, then we have a very good guarantee that we're going to last longer and be healthier. So we're working every day, and we work for your health and for your benefit. And lastly, in the last few years, we have come across a very important therapy, which is stem cell therapy. You probably have heard of it. At International BioCare, all the stem cell therapy that we do is from autols. It's actually what we call autologous stem cell. In other words, you're the donor, you're the recipient. And we're going to be looking for ways to improve the activity of those cells so you can get the benefit from them. We don't use any other foreign cells for you, because I don't believe in them, and I think they're still not to the point where we should be using them. But using your own cells can bring so many benefits. Platelet-enriched plasma can also do wonderful things for the quality of your life, for the quality of your joints, for many things that we can improve for you. So International BioCare is all about working around with different modalities, with a lot of testing, with good diet, with good food, with good lifestyle, in order to bring back the life, the performance, the energy, and the enjoyment that we all deserve. So we can live our lives very happy around our families.
In the operating room at BioCare Hospital, I understand that you perform all different types of surgery.
We are a general hospital, actually, by licensing. So yes, we have a surgical suite, we do surgery, and we're very conservative about that. We believe that, as engineers always say, measure twice, cut once, and we always try to do that, keep that as a very important motto. Make sure that we are going to use all the conservative methods before. But if the need comes around, yes, we have the tools, we have the way to confront that challenge and do it very well. Actually, I'm very proud to tell you that this is an operating room that many physicians in town ask me to use when it comes to their own family members. I have very good physicians in town that call me and say, my son is having surgery, can I use your operating room? Because of the standard of BioCare Hospital.
Dr. Rodriguez, thank you, and God bless you in your work.
Thank you very much.
Mr. Francisco, we feel honored to have him doing our blood today. Live blood. You see, the Bible says the life is in the blood. So if you want to know anything about your blood, you've started at the right place. Mr. Francisco, it's a privilege to have you do our live blood this afternoon.
Very, very welcome here. It's a privilege for me too also.
Now that you have watched the live blood analysis in process, you realize that nearly every ailment in the body, no matter what it may be, will show up in the blood. And with this, the doctors can decide what a person needs to do in order to take care of whatever the problem is. Mr. Francisco, I want to thank you. You have been such a blessing today. You found things that we didn't tell you. We did not in advance tell Mr. Francisco what was going on. And he found everything in Joanna, my wife, found some things in Daniel, my son, and found every problem that I have before I told you any of it. You found it in the live blood. I want to thank you.
You're very, very welcome.
God
Thank you
bless
for
you.
coming and bless you all.
Thank you.
Thank you, Francis.
You're very welcome.
Dr. Vasquez is my personal doctor here at BioCare Hospital. He's been such a blessing to us. And he takes care of the blood work. I am utterly amazed, doctor, at the amount of blood work and the test pages. Look at this, a page. All of these blood work that you did the first day I got here. Another page of it, another page. And we go on and on and on with literally pages of information that they've gathered here in order to tell exactly what's going on in your body. I understand a while back a patient came in and said, I saw about BioCare Hospital in Lindsay Williams DVD, and he said, I want the same Dr. Lindsay Williams.
That's correct.
I thought that was quite interesting.
And the reason of doing these tests is because we want to get as much information we can from you. It's very important to have also all the reports from previous visits so we can compare. It is very important to see how the response you're having and do the right treatment for you. For this reason, from the beginning, we're going to check your blood very, very good, including microscopic blood assessments, tests that usually are not available in conventional testing. This is very important because we can see things that are not ready available to show up in a conventional blood work, but they are kind of preliminary information that will tell us that you are in danger of having some particular condition. We're talking about free radicals, we're talking about clotting on your red blood cells, we're talking about a slow immune system, things that are not available in these tests. So we try to get as much information all together you have a better information about what's going on into your body.
Dr. Vasquez, I want to thank you for such a marvelous job that you do here at BioCare.
It's
And
always a pleasure working with you and your other patients.
so, if you'd like to get a complete, much better than you get any other place I know of, you'll get to meet Dr. Vasquez when you come to BioCare Hospital.
Thank you. A pleasure.
Thank you. Stem cell therapy at BioCare Hospital is one of a kind. Dr. Lustenau has pioneered this work and is a true professional at doing it. This is a standard size hospital room at BioCare Hospital, and the first thing that will be done is that the nurse will draw my own blood for use in the process of the stem cell enhancement and therapy.
Hello.
Stem cell therapy is the medicine of the future today. Your own blood is used for those stem cells. And after the stem cells have been enhanced, they can be used for numerous purposes. For instance, if a person has rheumatoid arthritis or has arthritis of any kind, those stem cells can then be injected into the joints with amazing results. Also, by all means, when you're doing a stem cell treatment, you must have a stem cell facial. Ladies and gentlemen, of course, you don't like to tell it, but ladies, if you would like to be years younger in a matter of hours, a stem cell facial is the ultimate in the latest of everything that you could have. Dr. Lustenau is going to perform a stem cell facial, and you'll be seeing something that, well, you may see it for the first time. I'd highly recommend, if you want to be years younger, this is the way to go, Dr. Lustenau. Thank you for what you're doing to help so many people.
You're welcome. We're going to start with the process now. Okay, we are going to do, he has a cream, that is, will be an anesthetic to prevent the pain. And then we are going to start with, we are going to use a roller, that will be a micro needles, where we are going to roll it all over, like where we are painting and putting new stem cells. That will be the PRP, the plasma rich platelets. And we are going to start with the process now, okay?
Now the stem cells, which have been enhanced in a sterile environment, will be injected back into my body, which through the bloodstream will circulate to every part of the body to create whatever is necessary. Understanding, of course, that stem cells can become anything. They can become a heart cell, they can become a brain cell, they can become a kidney, whatever it may be needed. And wherever the problem is, that cell will go back to that point and do the job that's necessary. Stem cells are one of the most amazing treatments and therapies of our time. And right here at BioCare Hospital, the stem cell therapies are done in a manner that you probably won't find done anyplace else. Stem cell therapy. Dr. Lustenau is one of the doctors on staff at BioCare Hospital. Dr. Lustenau, tell the audience what it is that you do here at the hospital. Some fascinating things. I'm amazed.
Okay, and I am the nutritionist, and I'm working for around 30 years. And we're working with the stem cells, the hyperthermia, and we're working now with the ozone therapy, and trying to do the best work for our patients.
And understand this is some of your new equipment here, ozone equipment of all things.
That's right, yeah. We are working with the ozone because, you know, that's something natural that we can use for our patient. Like what the ozone is not just the medication. What we are going to do is the ozone is going to stimulate our body, to stimulate our cells to produce like anti-inflammatory process, the analgesic process. It's going to get a better quality of red cells, and the irrigation will be much better. I mean, it's going to get the nutrients, the oxygenation to the brain and everywhere.
When people come to BioCare Hospital, there is literally a multitude of different therapies that you can get here. Many of them you cannot even receive in the United States of America. So, Doctor, thank you very much.
You're welcome.
BioCare Hospital, one of the amazing people that you will meet is Elias. This has been his castle for 28 years. And Elias has the unique ability of being able to always find that vein for intravenous therapy in the most amazing manner. And you punctured me many times. But to my knowledge, you get it every time.
I have done it. Yeah.
And also understand that you manage the hyperbaric chamber therapy.
Yes, or
Maybe you could explain some of it.
yeah. I've been here that length of time, and I've been using the chamber, managing the chamber, as you said, for more than 15 years. We have had these chambers on and off. Of course, this is not actually this is the newest, but we have had many. This is not the biggest that we have. Okay, the chamber, it's a pressurized chamber that you can see because it's inflated, and it has oxygen. Why does it have oxygen? Because we need, of course, the body to have more oxygen. The chamber promotes circulation, and as it promotes circulation, of course, the body will get benefit with the oxygen that we have in here. We do have about 85% of the oxygen. We have 100 atoms in the mixes. The mixes is with air, so we have about 85% of good oxygen in here. The patient stays 45 minutes. Now, patients who have problems with claustrophobia, they cannot get it. But we have tried also. A patient who's afraid of bees, we can control it with a little bit of sedative. It will be relaxed, and then the patient will go inside.
Elias, you're amazing. God bless you, and thank you for all your time.